Today we'll be demonstrating 3 procedures: the irrigation wound, a cultural full wound, and a wound dressing. The first step to performing these procedures is to check the patient health record. The purpose of that is to verify that these orders that we've been given they match what's in the patient health record. After verifying those orders, the first thing we want to do is perform hand hygiene and pursue identifying the patient. So I'd have the patient state their name, and I'd also have them give me his date of birth. I would then verify this information according to the patient health record, and then proceed with explaining the procedures to the patient. I'd ensure that we go ahead and get the bed lifted. Okay. It's not working right now.
Might be this outside wall. Oh, I got a broken bed. Okay,
Yep.
we
So
lifted the bed.
A mishap with the bed. We'll proceed. However, I would ensure that this bed is at least at my elbow height before performing any irrigation procedures with the patient. Upon lifting the bed, this is a multiple occupancy room, so I'd ensure that privacy is at optimal. There's optimal privacy for the patient. Had this been a single occupancy room, shutting the door would suffice. After which, I would then proceed to talk to the patient again about the procedure. I would talk to the patient about any pain that they may be having. In the event that there was pain that the patient may have, we would check the orders to verify that if there were any prescribed orders that I could give for pain, and then give that pain medication. And then we take time for that medication to actually take effect before we presume any irrigation or wound dressing procedures. In this scenario, this patient is not in any pain, so we will go ahead with the setup of our sterile field to perform the irrigation of the wound. All right, so I would raise the bed. The bed is raised. We're gonna act like the bed is raised. I am going to perform hand hygiene, and then I will get all my supplies out. This sterile field is kind of complicated.
Mm-hmm.
So in my sterile field, I do have my pre-filled saline syringe with my tape. Right, and then I will go ahead and prep, because we're going to be doing an irrigation, a wound, and a dressing for this wound. I'll go ahead and prep my pads on the sterile field as well.
I'm not the world's best videographer.
Okay. I'm not the world's very best demonstrator either. All right, so what we'll do first is I will go ahead and perform hand hygiene again. I will put on some clean gloves. Is the one over there?
You'll know where it is. Oh, you'll know.
All right, putting on clean gloves. And what I'm preparing to do is I'm preparing to remove the bandage from the patient's extremity. Oh my God. Okay.
Record.
All right, so here is our patient's extremity. It's actually in the abdomen area. So what I would do in this situation is I'd probably raise if I my bed work, I would raise the bed to kind of elevate the abdomen area, because as we're irrigating, we want to ensure that the fluid that's coming from the wound is running down into the basin that will gather here shortly. But in this scenario, my bed isn't working right now. So if there were a bandage here, the way we want to remove that bandage is we want to kind of hold the skin down and pull from the corner of that bandage and pull it back, lifting it up against the skin, pulling it towards the way that the hair is growing, if there were any on the abdomen. If for some reason we had any complications about removing that bandage, if the adhesive was sticking, we could use some saline or some adhesive remover to help with the removal of that bandage. Once the bandage is removed, we will assess the bandage. We'll look for odors, drainage, any abnormalities of maybe what may be coming from the wound. After assessing the bandage, we would then actually assess the wound. We'd be looking for just different granulation tissues, again, any other leakage or any other affected tissue or necrotic tissue. We would then check the drainage. In this case, our patient doesn't have any tubes. There's nothing draining the wound site, so we don't have that issue. So after removing the bandage, we go ahead and discard it. All right. I'll then go ahead and remove my gloves and perform hand hygiene again. And then I will don my sterile gloves. And prepare for the irrigation of the wound. Prior to doing that, my patient does have a wet-proof pad under here.
Got it.
Okay, so before I even do the sterile procedure, I would kind of just put the wet pad up under the patient. And then, in theory, I'd have a basin to, like I said, help drain this site once I begin. However, what we'll go ahead and do is I will now don sterile gloves. I'm kind of running out of space, so I'm going to just ease that over. All right. So with my non-dominant hand, I'll just pinch the right glove. My gloves aren't set up right, but I'll insert my hand, the first glove, and then I would insert my right hand, cuffing it and putting it on my left hand. All right. In theory, in a real setting, I would not be wearing my watch, but I am today. However, this is a demonstration. This is what not to do.
That diamond.
Yeah, that part. All right. So what I would begin to do is I am going to, this is in theory, a pre-filled saline syringe. All right. The idea, like I said, is to clean the wound, prepare for culture, and to redress it. So what I would do is I would hold the basin. I would provide a seal to the patient so that as I'm irrigating this wound, holding it 1 inch, at least 1 inch above the actual wound site, slowly irrigating, it could drain out into this basin. We want to drain this wound until the fluid is no longer cloudy, till it presents itself to be clear. So it may not be all of the saline, but depending how deep the wound is and how much we need to clean it, we may actually use it all. However, the guide is to determine that the fluid is actually clear. So after irrigating the wound, we'll throw this away to my trash area. All right, and then we kind of take some swabs and just clean the area of, just dry the area off of where we performed our irrigation. Trash. All right, the next step is doing a culture. We want to ensure that our culture is in a no, we don't want to do that. We would want to remove our gloves. First step, remove these nasty unsterile gloves now that we've performed the irrigation. We're gonna act like these are new sterile gloves.
I would have just kept them on and act like I did it 3 times.
Okay, all right. So I'll perform hand hygiene again, getting all that together, and I'll go ahead and get my culture set. This is, in theory, a Culturette tube, all right? With the Culturette tube, what we do is we twist and uncap the culture. This is our swab. We would then proceed to press firmly to the wound site, rubbing it around firmly into the wound to get a really good culture, being very, very careful that we don't touch any intact skin. All right? And once we get that good culture, we take the swab, we put it back into the Culturette tube, sealing it really tightly and capping it. So we'll put this to the side. What will happen with this is after I dress the wound, I won't do it now, but we'll go ahead and label this with the date, time, the wound site, and my name, and my initials, or excuse me, the patient's name, the date and the time, and the wound site of the patient. If we had used any antimicrobials, we would also document that on this Culturette tube. However, we'll put this aside for testing. All right. I would then perform hand hygiene again. At this time, we're gonna go ahead and redress the wound. So in theory, I've gotten my cotton swabs. I'm gonna go ahead and put those on the sterile field. Ensuring that they stay on the sterile field with everything else. All right. And then I have my gauzes already set up. I have my pad set up. And then in theory, this is the ointment that I'll be using for the patient. So I would go ahead and open this up. If this were really the topical ointment, I get my Q-tips. Didn't do that right. However, speaking, I'd get the Q-tips, I'd stick them in the ointment until I was ready to actually apply that topical ointment. So
in that,
just messed that up. However,
can I talk you through it really quick?
Yeah.
We'll just have it in the video. So you would put clean gloves on, put the protectant around
that's right.
the wound for any tape where it's going to go,
Yes.
and then clean gloves still, at least that's what it says in our steps.
Okay.
Then we're using sterile swabs
Gotcha.
into the, so.
All right. So what I will do is I'll go ahead and perform hand hygiene again. I'll put some clean gloves on, and I'll go ahead and prep the area of the wound, putting some skin prep around the area. And my screen prep is actually here, which is a mistake. This should not be here on the sterile field. However, we made note of that. But before we go ahead and dress the wound, it is important to go ahead and apply the skin prep just around the wound area, okay? Once we're done with that, we will discard it. I would then get my ointment together, and I'd have a space to apply this ointment. In theory, there will be a basin here in my sterile field that I could actually apply the ointment to. So we'll just act as if this is a basin and I'm applying the ointment, squeezing it onto the basin. All right, I'm pinching this. All right, I will then remove my clean gloves, perform hand hygiene again. All right, I would then go ahead and don my sterile gloves. Ensuring again that I maintain sterile procedure, even though I've jacked it up several times already.
Oh, what's that?
Okay. All right. So then.
Touch me, I'm sterile.
Donning these sterile gloves back onto my hands, new ones. All right. So we are now sterile. So what I would then proceed to do is in theory, here's my basin, here's my topical ointment. I will swab the gel or whatever the topical ointment is that's in the order for the wound. And I would take that and I'd swab the wound area for dressing. All right. I would discard this one. I get another swab, get more gel. This is a pretty big wound site. And I would then re-gel the wound, the inside area, discarding that swab.
I just feel bad for them because they have to watch all these videos.
They're gonna get a good laugh today. All right, then we take our swabs.
Swab?
We're gonna have two this time. It's a little large of a wound. We wanna make sure that that swab is at least 1 inch above the wound site. In this scenario, we're gonna make sure it's 1 inch below. And then we will apply our bandage, the blue side, the blue stripe up. Right. And then we will proceed to window tape. Window tape the wound area. Window taping is basically going from side to side, taping the area down of the wound.
I'm gonna stop you. I don't think they actually want us to tape these mannequins.
Okay, that's fine. I just want
to.
Okay,
cool.
So I'll actually just tear it off.
Like as you did it, I was like,
Yeah.
I think they said don't do that.
Gotcha. All right. So we will window tape the bandage down to the patient's wound site. After which we go ahead and remove our gloves.
Put me in for the next Pulitzer Prize.
And we'll remove our sterile gloves, we'll perform hand hygiene again. And at this time, what I want to do is I want to go ahead and get my label ready. What I do is I put my initials down on the piece of tape. I write my initials down, the date and time of the dressing. And I would tape it to the front of this wound site. After the client has been dressed, we go ahead and get the client comfortable again, covering them up, lowering the bed in this situation, and providing them the next care and comfort.
Time for a cheeseburger.
I'd say so, maybe a beer.
You wanna know the worst part? Do you wanna know the worst thing in the world? I didn't hit record.
Shut up. For any of it? Shut your mouth.